Welcome to the dark side of medicine, where those we trust with our lives can become our worst nightmares. Today we delve into the harrowing stories of the 8 most evil and worst doctors in recent history. Number 1. Paolo Macchiarini. Meet Dr. Paolo Macchiarini, a surgeon once hailed as a visionary whose ambition turned deadly. From 2010 to 2016, Macchiarini conducted experimental surgeries using synthetic windpipes at Karolinska University Hospital in Stockholm, Sweden. Defying essential approvals and ignoring standard medical protocols, his reckless experiments led to severe complications and multiple deaths. Yesim Setir and Andemariam Bayani were among the hopeful patients who tragically lost their lives. Imagine the crushing despair of families who trusted him only to face unimaginable loss. The dramatic downfall of Macchiarini, exposed by relentless journalists and medical professionals, underscores the catastrophic consequences of ethical breaches in medical research. Number 2. Ian Paterson. In the quiet towns of Birmingham and Solihull in the UK, Dr. Ian Paterson, a breast surgeon, committed unthinkable acts. From 1997 to 2011, Paterson performed unnecessary surgeries, including mastectomies at Spire Healthcare and Heart of England NHS Foundation Trust. By fabricating cancer diagnoses, he inflicted profound physical and emotional scars. Debbie Douglas and Frances Perks were among the many victims left disfigured and traumatized. Their trust was cruelly shattered. In 2017, Paterson's heinous actions led to his conviction and a 20-year prison sentence. This dark saga spurred an independent inquiry and major changes in medical regulation, highlighting the need for vigilant oversight to protect patients from harm. Number 3. Fateh Farid. In Detroit, Michigan, Dr. Fateh Farid's greed knew no bounds. From 2009 to 2013, this oncologist fabricated cancer diagnoses, subjecting patients to unnecessary harmful treatments at Michigan Hematology Oncology. Driven by financial greed, he defrauded insurance companies out of millions. The elderly and vulnerable patients endured debilitating side effects for treatments they never needed. Donya Harmon and Patricia Hester are just 2 of the many who suffered. Imagine their terror, thinking they were battling for their lives only to discover it was all a lie. In 2014, Fateh was arrested and sentenced to 45 years in prison. His story is a stark reminder of the perils of unchecked greed in medicine. Number 4. George Tyndall. At the University of Southern California, USC, Dr. George Tyndall preyed on vulnerable students for nearly 3 decades. From 1989 to 2016, Tyndall, a gynecologist, abused hundreds of young women during examinations. These students, often far from home, trusted the university's care. Instead, they faced unspeakable violations. Imagine their shock and betrayal. In 2019, Tyndall was arrested and now faces multiple charges of sexual assault. USC's $215 million class action settlement with victims reveals systemic failures. This harrowing case prompted major policy changes to prevent such abuses, emphasizing the critical need for accountability in patient care. Number 5. Christopher Duntsch. Christopher Duntsch, infamously known as Dr. Death, practiced neurosurgery with deadly incompetence. Between 2011 and 2013, Duntsch performed spinal surgeries that left patients permanently injured, paralyzed, or dead. Mary Eford was left paralyzed and Kelly Martin tragically bled to death. Imagine the horror and betrayal experienced by patients and their families, trusting their lives to someone who should have been their savior. Despite complaints, Duntsch continued practicing due to systemic failures in reporting. In 2017, he was convicted of aggravated assault and sentenced to life in prison. His story is a chilling reminder of the dire consequences of a flawed medical system. Number 6. Dr. Kermit Gosnell. Dr. Kermit Gosnell operated the Women's Medical Society, a clinic of horrors. From 1979 to 2010, Gosnell performed illegal, unsafe abortions in deplorable conditions, serving a desperate community. Women seeking help were met with outdated equipment and unsanitary practices. Karnamaya Monga's tragic death from a drug overdose during a procedure is just one devastating tale. In 2013, Gosnell was convicted of first-degree murder for killing infants born alive and manslaughter for Monga's death. His life sentence without parole highlighted the urgent need for better regulation of medical practices in vulnerable communities, a grim reminder of healthcare's darkest failures. Number 7. Michael Swango. Dr. Michael Swango, a seemingly dedicated doctor, worked across the United States from 1983 to 1997. Beneath his charming facade, Swango poisoned patients and colleagues with lethal doses. His malevolent actions spanned South Dakota, New York, and Ohio, leaving a trail of fear and confusion. Imagine the anguish of families who lost loved ones without understanding why. Swango's cunning allowed him to evade suspicion by frequently changing jobs. His reign of terror ended in 1997 with his arrest. Though he confessed to killing 3 patients, many believe the true toll could be as high as 60. His story is a stark warning about the importance of vigilance in the medical profession. Number 8. Harold Shipman. In the United Kingdom, Dr. Harold Shipman, a trusted general practitioner, became one of history's most prolific serial killers. From 1975 to 1998, Shipman was responsible for the deaths of at least 15 patients, though some believe the number could exceed 250. His victims, mostly elderly women, trusted him implicitly. The shock and sorrow felt by families discovering their loved ones were murdered by a doctor they relied on is unimaginable. Shipman's respectable position shielded him for years. His arrest in 1998 and subsequent conviction in 2000 for multiple murders led to life imprisonment. His actions spurred significant reforms in UK medical regulations, emphasizing the vital need for trust and accountability in healthcare. These stories remind us that trust, when misplaced, can lead to devastating consequences. Stay informed, stay vigilant, and always advocate for your health. If you found this video informative, please give it a thumbs up and subscribe to our channel for more historical content. Don't forget to share your thoughts and opinions in the comments below. We'd love to hear from you.